which is a deep and labored breathing as the body tries to move carbon dioxide out of the blood, in an effort to reduce its acidity. Cells also have a transporter that exchanges hydrogen ions, or protons, for potassium. When the blood gets acidic, it's by definition loaded with protons that get sent into cells while potassium gets sent into the fluid outside cells. Another thing to keep in mind is that in addition to helping glucose enter cells, insulin stimulates the sodium-potassium ATPases, which help potassium get into the cells. And so without insulin, more potassium stays in the fluid outside cells. Both of these mechanisms lead to increased potassium in the fluid outside cells, which quickly makes it into the blood and causes hyperkalemia. The potassium is then excreted. So over time, even though the blood potassium levels remain high, overall stores of potassium in the body, which include potassium inside cells, starts to run low. Individuals will also have a high anion gap, which reflects a large difference in the unmeasured negative and positive ions in the serum, largely due to the buildup of ketoacids. Diabetic ketoacidosis can happen even in people who've already been diagnosed with diabetes and currently have some sort of insulin therapy. In states of stress, like an infection, the body releases epinephrine, which in turn stimulates the release of glucagon. Too much glucagon can tip the delicate hormonal balance of glucagon and insulin in favor of elevating blood sugars and can lead to a cascade of events we just described: increased glucose in the blood, loss of glucose in the urine, loss of water, dehydration, and in parallel, a need for alternative energy, generation of ketone bodies, and ketoacidosis. Interestingly, both ketone bodies break down into acetone and escape as a gas by getting breathed out the lungs, which gives a sweet, fruity smell to a person's breath. In general, though, that's the only sweet thing about this illness, which also causes nausea, vomiting, and if severe, mental status changes and acute cerebral edema. Treatment of a DKA episode involves giving plenty of fluids, which helps with dehydration, insulin, which helps lower blood glucose levels, and replacement of electrolytes, like potassium, all of which help to reverse the acidosis. Now let's switch gears and talk about type 2 diabetes.